around, it's been dragging you down, and get up in the air. Just pretend that you can fly. You'll never know if you can till you try.
Hi, and welcome to Cannabis Helps Dementia. I'm Chella.
I'm Dave, and right up front we'd like to say that we're not doctors or medical professionals, and nothing you hear in this podcast should be considered medical advice.
Right.
We're not experts, but throughout this podcast series, you'll hear from doctors, nurses, research scientists, administrators, other caregivers, and people living with dementia about how cannabis helps.
Like it did for our family.
That's right.
After my mom was diagnosed with dementia, we were thrust into family caregiving and became fierce advocates for people living with dementia,
including their access to cannabis medicine.
Retired Army Colonel Dr. Philip Blair is a family physician, complex disease management consultant, and remarkable cannabis medicine expert in the Pacific Northwest, providing services globally.
After graduating from West Point, he trained as an Army family physician and served as a combat doctor during the First Gulf War. He retired from the Army as a full colonel after serving as a medical officer on 3 continents. In 2014, Dr. Blair began studying, treating, and lecturing about the human endocannabinoid system and the non-impairing parts of the plant, including cannabidiol, CBD.
Dr. Blair believes that endocannabinoid system disorders are the root cause of many chronic medical problems, and his goal is to restore quality of life and health using diet, exercise, appropriate medications, and non-impairing herbal nutritional supplements, including the plant terpene beta-caryophyllene, a product derived from hops. You can find links in the description.
Clinically, Dr. Blair has treated thousands of patients with CBD and has seen remarkable results with people living with dementia. He has a passion about treating dementia and advocating for the use of cannabinoids in the treatment and prevention of neurodegenerative conditions of all kinds.
Well, thank you so much, Dr. Blair, for joining us on Cannabis Helps Dementia podcast.
I'm delighted to be with you today and to talk about this very important subject.
It is huge, and we've seen a presentation of yours that talks about the statistics and the data around Alzheimer's, and we're well aware with that. Chella's mom suffered for 10 years. And that's basically how we came to know that cannabis did help dementia. Mm-hmm. And so Dr. Blair, as a retired U.S. Army colonel who was basically in the mainstream medical system in the military for years, almost 30 years, I think, and practicing medicine now for over 40 years, how on earth did you come to be a strong advocate of cannabidiol and cannabis medicine?
Well, I was looking for solutions that conventional medicine really wasn't offering. I was looking at an approach that would be benign in that not causing any harm, but to go well beyond what was currently available in conventional medicine. I was introduced to CBD. I had previously been a test officer detecting THC in people and in workers and identifying them for disciplinary action, and of course within the military. But when I started reviewing the literature in 2014, I was amazed at what information was now available and the extraordinary benefits and the potential for using cannabinoids, and particularly CBD, in preventing disease and mitigating against disease and actually resolving some problems for which we did not have any effective therapy. So for the last 7 years, I've been studying, exploring, and experimenting on a small scale clinically to find out how I could affect some of these pernicious diseases, including dementia. First off, let me get to the core of what I'll be talking about. Number one is that there are many different causes of dementia. There's lots of different reasons why we develop dementia, and it's not just one single pathway. The endocannabinoid system is really at the heart. It's sort of the digital transfer and exchange information that is part of the process of developing dementia, but also part of the solution. And so it's at that key function in the brain to help protect us, but it also, if it's used improperly, it can actually cause disorders. We've got to look at using this endocannabinoid system to modulating it, and so that we can correct for some of the inflammatory disorders that we face with dementia. And we also need to address care providers like yourself. You know how much pain and suffering that you went through as a care provider or a family member in what was going on with your loved one in that regard. We've got to respect that, and the caregivers are very important for that. We've got to go beyond the phytocannabinoids, and we're talking about the sleep, the exercise, the activities that people do, and the nutrition. And nutrition is very key and important. And you're going to bring up one of those questions about keto and why keto is beneficial in some of those situations as well. And finally, what we can do with the phytocannabinoids and these other substances that work through the endocannabinoid system is actually prevent the disease, and manage it, and even reverse it in some cases. And we can also take care of healthcare providers. So I think that the phytocannabinoids and working through this endocannabinoid system, we have a great potential for modulating this disease and this near disaster train wreck that we are facing in a number of years.
Well, we'd love to hear about one or two of your patients.
We know Teresa's story,
Right.
The video of Teresa. How is Teresa doing? Is she still with us and still thriving on CBD? And since those videos, have you had more patients with dementia come your way?
Teresa is a great case, and I'm delighted to be able to talk to you about her. Now, she's a 61-year-old woman who had trisomy 21, so she had Down syndrome, and she was, that's actually quite senior for someone with Down syndrome, but she rapidly disintegrated and degenerated into a full-blown, angry, and difficult to control dementia patient over a period of 1.5 years. And one of the biggest problems was the threat to her sister, who was taking care of her, because the woman, Teresa, had become violent and had knocked her at the stairs, but not down the stairs. Unfortunately, there was no terrible things that happened to the sister. But she was desperate and she needed some help. Otherwise, then Teresa would have been incarcerated. Well, I had been exploring the use of cannabidiol and some of the other phytocannabinoids and terpenes, and I suggested that we might be able to use some of these for her. Now, she was living in Canada, and to get across the border could have been somewhat of a challenge, but I was able to send a package of cream to her that was laden with CBD and another terpene called caryophyllene, and mix that in a topical cream. And over the course of the next 2 weeks, she made dramatic improvements just by a topical application on the chest and the neck. To the point where she was smiling, she was laughing, she began eating again, and she had stopped eating, and she was cooperative and followed directions quite well. So I was totally amazed by the response and the rapidity, and plus the topical approach was a great surprise to me that we could get the level of penetration and we could affect the changes in the brain for her.
Yeah. Was there a lot of CBD in the cream? Was it a very high concentration?
No, there was it was about a 10 or 20 milligrams per milliliter. And so the application was just a small amount, a fingertip that would be rubbed into a surface area of about a square foot on any skin surface. And I left that to the sister in order to decide where that would be.
Yeah. Amazing.
And the terpene that's in there, is there a connection there? Is that why was that specifically the terpene you're using? Is there a
well, I won't say, all of the cannabinoids really work as a team.
Right.
Yeah.
So their THC is a good team member, but there's a terpene called beta caryophyllene, which has extraordinary properties. It is a specific CB2 agonist. And because of that particular action, and now that's a key pathway for all of your inflammatory activities. If you can regulate that particular pathway, and of course the CB2 receptors are all over the body, and if you can modulate that and activate that with a very specific agent, then you're going to get this extended anti-inflammatory response. And caryophyllene is one of those substances, a terpene, that is widely available in our food supply that can be used in that application. In fact, caryophyllene has been used specifically for dementia and in some preclinical trials, and it has been very positive.
I'm wondering if L-pinene might not be another one to add based on Ethan Russo's work on his
Well, that's
memory molecule.
That's possible. I think we have to explore all of the terpenes.
Sure.
About what we do know very specifically about caryophyllene, and
Right.
there's thousands of studies that have been done on it, and the connections are quite deep into its modulation, and it works in many similar ways to CBD, but it's more of a targeted approach to that CB2 receptor, and that's modulating anti-inflammation.
Which is
Whereas
happening apparently.
cannabidiol,
Right. I'm sorry, go ahead.
well, cannabidiol sort of lifts up the tide. It raises the levels and upregulates the endocannabinoid system, balances things out, and mitigates it against some of the negative aspects that we encounter with our physiology. You've got caryophyllene is actually targeting the anti-inflammatory key receptor that is involved with all of these inflammatory processes.
Yeah, that's fascinating. We know, just continuing on the topical for a minute, we know how powerful it is in a demonstration. If you give people with arthritis pain or anything, just put a topical on, it's highly effective quickly. But to see that level of change with a topical application is just mind blowing. But the CB2 receptor, like you say, is everywhere. It's really just inundated throughout the whole system. And the connection between Alzheimer's and the ECS system is really fascinating. A dysfunctional ECS system is really fascinating to me too. That, really a lot of these chronic diseases seem to be a dysfunction of the ECS. And really we need to be, the care and feeding of the endocannabinoid system seems to be really where we need to start to prevent all of this stuff.
Absolutely. And a lot of our behaviors and our lifestyle play into that as well, whether it's omega-3s that need to be part of that, our particular diet, or avoiding omega-6s, which are inflammatory, getting our exercise, getting proper sleep, avoiding stress. These are all factors that are create an inflammatory situation in the body and in the brain.
Cool. I heard you mention a few minutes ago about THC. And I just want to talk briefly about THC as well. My mom really benefited from full spectrum cannabis oil way back in 2011 and until she died, actually. But as we grew and we started learning more and CBD came online, because it really wasn't a thing back in 2011. As CBD came online, we started introducing that into our treatment program as well. It's THC though was all we had. So what about THC in people living with dementia? Have you found that low dose ratioed products are helpful for your clients, or what are your thoughts on that?
Well, there's several issues that you have to confront. Number one is THC is legally regulated in most places. It's federally legally regulated. And who's getting dementia? It's an older generation, and they have been subject to 80 years of negative propaganda. So you want them to take something that they've been brought up with to know that this is a poison and it's detrimental. And
yeah, that's one of the number one things we run into
sort
with that population. Absolutely.
Yeah, no, there's no question that THC has value. It's certainly analgesic. It's got anti-inflammatory properties. It's got sedative property. But one of the problems that you do face is this down regulation of the endocannabinoid system. You don't want that to happen. And on the other hand, you've got CBD that is upregulating the endocannabinoid system, balancing that. We do know there are adverse effects to THC, getting too much or getting exposure to pets or other people, and there are addictive tendencies with THC. So you have to use it, but you have to use it carefully, probably in a small ratio, like all of the substances that come from a full cannabis plant and plant derivative. You need a whole plant or a substance. And we know very clearly that this entourage effect, and THC it can be part of that entourage effect. Now I start with, if I have a dementia patient, I start with about 10 to 15 milligrams on a twice a day basis for those individuals. They don't need much. And then even though people point to, and I'm talking CBD.
Okay, cool. Just to clarify.
And the products that I typically use are about 1 to 20 or 1 to 25, meaning the amount of THC that's in it. So a small portion of it, but it is there, providing that entourage effect, just like beta-caryophyllene is present in the full plant of cannabis, but beta-caryophyllene also comes from other plants. So I want a whole plant, and I want a balanced formulation. And using relatively small doses, I have not had very much difficulty in modulating somebody's symptoms, or with dementia, or their agitation, or with actually making some corrections and an improvement in their cognitively and as well as their physical ability.
Wow. So the THC needs to be there to help with the entourage effect, but the low dose is highly effective. I know many people, many of the doctors and nurses that we've spoken to are very supportive of starting like maybe at 1 milligram and slowly going up from there to find what works, and that you don't need that much. And certainly 20 to 1 is very effective in many people that we see up here. And we're finding more and more that low dose is the way to go with THC. And where you get into problems is the higher concentrations and using large amounts of THC in short periods of time. Not that it's ever killed anybody, but you definitely have, there is certainly acute impairment and side effects that you want to avoid. And of course, we're not so, the patient population we're talking about is not so worried about addiction. I think specifically on lower milligram dosages. And we've worked with a number of people in California here with seniors that are very effective with a 1-to-1, or even a lot less than that, like a
20 to 1,
20 to 1 or 2 to 1 CBD dominant. I guess in Washington they do it back the other way, 1 to 20 as opposed to 20 to 1. It'd be nice to have some standardization, but that's way off as is legalization in this country, I fear.
Are there any drug interactions that people might want to start looking out for if they're starting to use CBD or cannabis therapy?
If you look carefully at the literature, the drug interaction potential is really overblown. When in some of the studies that were done and were modeled after Epidiolex, and the average dosing is about 15 milligrams per kilogram. Well, that's a massive dose. Whereas if you use a full spectrum biologically derived plant, you can do what I see is at least 1/10 or 1/20 of what you would use with Epidiolex. So you get the interactions when you get the high levels of CBD, and it starts to interfere with some of the CYP 450, but very, very seldom. There was a great study that was done in an individual who was on blood thinners, and they found that there was no problem with thinning of the blood and the dosage until they got to approximately 10 milligrams per kilogram of CBD. So I use that as a guideline. We're really not interfering with the coagulation, and it was a case study. Wasn't a wide population study on it, but I thought that was exemplary of the situation that we generally encounter. People using a full spectrum are using very small doses, as I mentioned, like 15 milligrams twice a day or less, and they get along quite well. Now, I do like the idea of using a THC for the additional sedative properties, or if you're not responding to CBD, and then you might need a different balance. And I think that's very fitting to use that.
Excellent.
Yeah, that's great. That makes a whole lot of sense.
It does.
The fact that the stigma is huge, and to start with CBD that is so effective, it's almost like it might be a gateway. To more little, adding a little THC down the road. But
maybe they were right.
and also the studies on the toxicity problem too. I mean, the studies about liver damage are also with huge doses of CBD.
So, exactly. Yeah, I mean, they're monstrous dosage. And even some of the cases were at 50 milligrams per kilogram, massive amounts. And nobody can afford that, number one, at least not if you're buying it yourself.
Yeah, that's like the Alzheimer's study with Dr. Babak Baban. The amount of the CBD being used in that study to reverse Alzheimer's in the mice is, short 2 weeks, but very, very high dose.
There's a lot more time in people though.
Right.
Right.
And you're finding when people come off of the CBD, your symptoms return?
Well, no, there's a lag time. They could, but I don't know of anybody who's really come off it. Yes, I do. There was a situation in Australia. I had a client and they were treating their mother. We got her started. She cleared up her mentally. She was functioning around the house. She took a safari to Africa. Now she's from Australia. She was in Africa, went on a safari, forgot her CBD. She went through 3 weeks of safari, no problems. When she came back, it sort of hit, she came back and she had a meltdown. And so she went back to the other symptomatology. You have to keep up with it in order to sustain those metabolic, those epigenetic, and those neurotransmitter regulations and endocannabinoid system regulation that needs to be there, just like you need to take a nutrient. And that's my approach, is that I like to look at these cannabinoids, the phytocannabinoids, as essential nutrients. We've got essential oils. I see that this is just another one of those essential oils.
Excellent.
That is so refreshing.
Totally. So speaking of diet, we know that cannabis medicine works better with a healthy lifestyle and a good diet. We've been learning recently about healthy keto and how healthy keto is really effective in people living with dementia. Could you talk a little bit about your findings in that regard?
Well, I'm excited. That's my other passion. I ran a disease management program for almost 10 years, and we incorporated a very low carbohydrate ketogenic type of program to get people out of inflammatory situations. That's before I knew about the endocannabinoid system. And what we were doing, we're actually capitalizing on the endocannabinoid system using ketones. Ketones are signaling molecules that actually activate the PPAR receptors on the nucleus and shift towards an anti-inflammatory effect and a metabolically beneficial. So it's reducing inflammatory responses both throughout the body as well as in the brain. And of course, our brain actually can utilize these ketone bodies very, very efficiently. And it may be actually protective against the mitochondrial dysfunction that we see with with dementia, in particular, where we're calling type 3 diabetes dementia. Then a lot of that has to do with this insulin resistance that occurs in the brain. Ketones, and using this ketogenic type of diet, you can bypass that and you can feed those mitochondria, restore those cells to health, and keep that nutrition up and provide an anti-inflammatory response. Plus, if you're using CBD with keto, you're actually enhancing the absorption. Now, this is not well recognized, but when you use CBD with a fatty food, it gets absorbed in the intestinal lymphatics. And when it goes to the intestinal lymphatics, it gets distributed to our lymphatic organs and our immunologic systems. And it doesn't get worked on by the liver until it actually enters the circulatory system. Meanwhile, it's concentrating its effect on the immune system. And you actually get very, very high levels of CBD, as much as 200 times what you find in the plasma by taking it with a fatty food and going through that absorption technique.
That's great. That's amazing. So you eat it with your fat. That's
yes. You have it with butter. Have it with cream.
Have it with butter.
Put it in salad dressing.
Yeah. There you go. Oh yeah.
Use it as part of your salad dressing.
Keto salad dressing.
I'm hoping that one day we will have just like minimum protein, iron, FDA requirements for those nutrients for cannabinoids.
Well, wouldn't that be fascinating?
Well, I'd like to tell you another case story, if you would.
Oh yeah.
Please.
Absolutely.
Yeah, so my first days, I was very interested in people with post-traumatic stress disorder, and I am, but I also was interested, of course, in dementia. And there's this family called me up and asked me to help with this 82-year-old man that was living in Florida, and he was a disabled Korean War veteran, and he'd suffered a stroke some years before, and he had vascular dementia, post-traumatic stress disorder, diabetes, and a neuropathy, and he had a familial tremor. And then they asked if CBD would be effective for him. Well, I set him up with a small dose at 7.5 milligrams of CBD, and I wanted to start off slowly at 1 milligram. That night, after his first dose, he slept all night, and in the morning, he said his reaction is, "I want more of that stuff," and because his wife was somewhat impaired, at least physically, she didn't notice that he took at least 10 or 12 doses of CBD over that time, and it truly activated him. And he had this wonderful response, and he was vivid, and he was thriving, and his neuropathy was improved, and he was too energized. He actually became a problem he went to a church revival meeting and announced his healing to the congregation, and the pastor thought he was delusional, but in fact he was just recovering from his dementia, and he was having that particular beneficial response. But he had too much too early, and so it sort of overwhelmed his activity and his symptoms, and his family wasn't prepared for his recovery. And so they were very much concerned about an overdose or a toxicity that he might be experiencing.
Right. It's like he ate a brownie of CBD that was a little overwhelming.
Yeah, and that's happened in other cases. And so you need to start off slowly, but you have to sort of treat the family at the same time, because they have to understand that there may be a rapid change for the individual, and that there would be a rapid recovery, and that they need to control it so that the person doesn't act beyond what their real capabilities are.
Right. Was the family taking CBD also?
No, they actually were not. They were afraid of it, then going through that propaganda.
Yeah, even with CBD. Yeah.
Poor things.
And this law that they're introducing, this discussion bill that they're introducing federally, of course, looks like they're going to, take it from one bureaucracy and put it into three. One being the FDA, which I'm sure they're going to start trying to make tons of rules around cannabis. And similar to what's going on with hemp, I mean, the FDA hasn't made it easy for hemp products either to really make it, and certainly to help with lower cost. But certainly it has opened up this amazing molecule to so many people around the world, internationally, and so that's awesome.
Well, you talk about regulation, and I think this whole idea about regulation. First off, why do you regulate something? Is it because it's a danger to society or it's a danger to health? Well, if I don't think that's any different than iron, any foods that or any substances that are out there that we eat. It needs to be make sure that it's manufactured by good practices. You don't have any toxins in it. It's not poisoned in some way. That's very clear. But otherwise, this is a natural plant. You're trying to regulate a plant, which is, golly, that it's not possible to do that effectively. And so if you have this breakdown, if you can't enforce it with helicopters and dropping defoliants on the area, then why are you trying to regulate it? It doesn't cause any harm. There are no issues with death or destruction. It seems to be an exit drug, not a gateway drug. And so what we're getting involved with is this regulation. Maybe it's a transition period, but this is something that anybody can grow in their backyard. And so I think that what we need to do is we need to free up all the regulations, stop the taxation on it, and make it available so that everybody can use it and actually promote it. promote it so that it's being used. And, this is a safe substance. A good product is going to give you relief from anxiety, depression, pain. It can, and you're going to generally sleep better with it. So you've got all these positive things. And if you're not regulating, if you're not trying to regulate and creating that bureaucracy that you talked about, I mean, there's nothing to it, and you can lower the prices as a result of that. So it's available to everybody on this, in the stores, whether it's produced or somebody's growing it.
Right. Well, I think that has to be included, and just to sort of touch on that, everybody had to grow hemp historically back in the day, and even in World War II. And I'm just wondering, I'm making a connection, it was so used so often. Cannabis sativa L was used so often in every medicine. And that type was more of the industrial type of hemp grown. It wasn't, it was the long, stocky stuff that was made for fiber, for seed, and they got their medicine from that. So relatively low THC, I'm thinking, was probably the case, even though there was it in there. They didn't know what it was. But I'm thinking it's probably was higher in CBD than it was in THC, because we've created that part of the plant because of prohibition. We decided to concentrate it all. If it hadn't been for prohibition, we might have stuck to the lower CBD plants that people are growing. And really, you said there are two types. Really, there are three, aren't there? There's this sort of middle ground where they're using, the cannabis growers have found a way to grow high resin value CBD plants. And that's where it gets into, you better trim it before it gets to 1%, otherwise you're messed up. So really, just touch on that a little bit. What is the difference between medicine from cannabis? We've heard people that hemp's no good. You got to get it from cannabis. We've heard other things that said, oh no, you can grow hemp that has plenty of medicine. So have a little bit, what's the distinction you think?
Well, cannabis is all the same plant, and you're trying to define it by the chemicals inside or what's behind the clothes and underneath the skin. And it's really very difficult to do that. The fact is that you get benefits from whether it's a high THC or a low THC, high CBD or a low CBD. And we no longer have those particular strains now it has to do with cultivars, and it had over the years in the past century, then they've blended all so that you really can't define one very much on its outward appearance. What's inside of it. You really can't tell without an analysis going on. You have a general tendency. And what we're learning is that sub-cultivars are actually very beneficial for specific types of problems. And that probably has to do with that entourage. It's not the CBD or the THC alone. It's with that combination of those flavonoids, those polyphenols, those tannins that are present, along with that blend of the different cannabinoids that are present with it.
Yeah.
But we don't give full service to the endocannabinoid system. There are so many of the different herbal preparations that we use that are actually modulating the endocannabinoid system, like echinacea, curcumin, or resveratrol. They all work at least partially through this endocannabinoid system, modulating the CB1 receptor in particular. So we're using the cannabinoid system, the endocannabinoid system, very, very extensively in our herbal. And then not only that, is we actually have within our own endocannabinoid system, we have a couple molecules that the body produces in response to different stresses. For instance, it's the N-acetyl ethanolamides. And what I'm talking about, of course, about anandamide, and 2-AG, but what about palmitoyl ethanolamide or oleol ethanolamide? They are right up there in the same category, and they are available at Amazon or other stores. And they have actually shown profound effects on the brain and protective effects for dementia. So that, you have to look at the endocannabinoids that are actually available at the present time. And then we mentioned earlier about omega-3s. Omega-3s are really important. And what we find is that CBD doesn't work well unless you have a sufficiency of omega-3s. And that's because of that, you need those omega-3s to build up and have the entire endocannabinoid system working properly. So it's all in concert. It's all about a healthy diet and a healthy nutrition and healthy activities.
All those herbs you mentioned are herbs that people say help people living with dementia. And the more I learn from the doctors that we talk to, the more I really do believe that Alzheimer's and dementias might really have a lot to do with the endocannabinoid system.
Oh, very definitely. We know that there are, within the endocannabinoid system, as we develop dementia, there are shifts in the endocannabinoid enzymes, as well as some of the agonists and the receptors. And so when you see that shifting that's occurring, the body is responding to stresses, probably inflammatory stresses that it's facing. And in that response, it's trying to compensate, but it just doesn't have the substrates, or it's overwhelmed by the particular pressure and the stresses that are on that. And so if we can adjust for and upregulate the system, then maybe we can respond very effectively to some of these new stresses that are going and the neuroinflammation that's taking place.
So many people, though, in the United States are using CBD or some form of cannabis. Isn't it almost malpractice for doctors to not know something about the ECS or cannabis medicine?
Well, no, not if they're not teaching it in medical school, and only about 8% of schools actually teach anything about the endocannabinoid system.
Yeah.
When I discovered and I became aware of the endocannabinoid system, then I didn't understand how we could practice medicine. We could train our physicians and train medical professionals without understanding how modulating this particular system is for all of the other systems, whether it's the inflammatory system, the metabolics, whether it's the digestive or the
Immune.
Immune and the circulatory system, the cardiovascular. I mean, it touches everything. And it seems to be, I like to look at it as a chemical digital software system that the body uses by outside signals, sort of activate this endocannabinoid system, and then it is broadcast through the body in different ways. And then our internal environment actually broadcasts our behavior through the system. It's that the digital software that's actually carrying the effects both in and out of the body.
Yeah.
It's a great analogy,
Yeah.
actually. That's fantastic.
Yeah.
You've been doing some recent work with non-cannabis cannabinoids.
Yeah.
Well, that's exactly what, you got PEA, palmitoylethanolamide, oleoethanolamide, and beta-caryophyllene. Beta-caryophyllene I'm really excited about that because the range of benefits is so broad. It's hitting on such key areas and key important areas, including these nuclear receptors and signaling metabolic changes like lowering cholesterol, lowering lipids, as well as lowering blood glucose and modulating for diabetes, as well as the LDL and the HDL in the body. In addition, it's got that anti-inflammatory effect. And this all comes from black pepper, from hops oil, or many of the oregano and many of the foods that we've been told by our mothers to include in our diet because they're nutritional. If you look at the range of foods, there's over 1,000 different foods that contain this terpene, this valuable terpene that has this wonderful effect on our bodies.
But these are cannabinoid-like molecules that work with the same receptors and enhance the system. So, it's not just this plant, it's all plants that have the molecules that we need to nourish this system and to get the best,
well, all plants have the potential, but they don't all carry the substances that will do that.
Sure.
We have with some selected plants, we do have that crossover where they're actually activating some of the classic cannabinoid receptors that we know about, the CB1 and CB2, and we're modulating those in a very constructive way.
And we'd like to know what's going on with the tests you're doing with macular degeneration and CBD.
Well, I had interesting story. I had a patient that was we're blending some CBD with caryophyllene and using a high caryophyllene blend of CBD coming from the manufacturer. And we actually provided a little bit of terpene enhancement for that. And I also have been using caryophyllene as a topical oil for real benefit. And she accidentally vaped the BCP. And I was very concerned about her and when I found out, I was very worried about her. But in fact, she did very well. And she thought it was a very benevolent response that she had. She felt really good with it. So I realized and I looked over the literature, and it did not pose any particular problem to inhalation in small amounts. So I thought that there may be some potential for people with particularly eye diseases that they might benefit. And I had one client who was using a CBD vape, and he had made some improvements, but not to the degree. And he was using a high dose of oral CBD, and he also made these improvements, but not to the degree that we were hoping for. And then, so I found that combining CBD with caryophyllene in small amounts was able to actually reverse his eye disease in a 4-month time period. Whoa. And so with that, we formalized the formulation, and we corrected it for best absorption. And what I'm seeing at the present time is that I've got about 6 patients with advanced types of macular degeneration, or in one case, it was a retinal vein thrombosis. Using the vaporized approach seems to have been able to mitigate against that inflammation, reducing the inflammation in 1 month by 80%. So you had this edema that was measured by using retinal scans and reducing that edema over that period of time. Now, I only have a small number of cases at this point, and I don't know if there are any long-term problems that are associated with it, but nobody has had any difficulty at this time. And so in that process, I'm trying to get more people who are facing some of these challenges with macular degeneration or thrombosis of their retinal veins, and then maybe using the eye injections, Avastin eye injection, and in place of that therapy, using this vaporized approach, getting scans and identifying improvements that are made in there. So I don't know why. I'll let you talk first.
No, please. I've got 2 people for you. Please go on.
I was gonna say, that sounds like a good study.
I don't know why it's working so much more effectively. I can only theorize that using the vaporized formulation allows better penetration into the brain, and to the eye very specifically. We have a blood-brain barrier, but we also have a blood-eye barrier. And being an extension of our brain, then it only makes sense that we have this particular mechanism that blocks off many of these molecules. And by using a vaporized approach where you inhale the blend, goes into the lungs, and then it gets absorbed through the capillaries into the circulation to the bloodstream, and that's delivered to the brain right away. So you got first pass with the brain and the eye, and you can get, I believe you're getting better penetration, and you're getting this immediate response. And most of the eye diseases are actually, and the retinal diseases even, are inflammatory in its basis. And so if we can mitigate against that inflammation and deliver CBD as well as caryophyllene to the area, we may be able to stop this process. And I've been successful with a few cases thus far, and I'm hopeful that others may benefit from this as well. But it's important, one more thing, it's important that I'm able to document it, and that requires doing retinal scans to show the reduction in edema that goes along with it.
Absolutely, you need that. They need those numbers. They need those actual.
Yeah, we do.
Can't just be anecdotal for them.
Yeah. Anyone, really.
For anyone. And how does one vape beta caryophyllene? What is the form that it's in?
Well, vaporized formulas typically will go in an e-cigarette. There are other devices that you can use, but it's a mixture. Typically, it's going to be vegetable glycerin, and then you'll have a certain amount of CBD in it, and then a certain amount of caryophyllene will be mixed in it. It'll be a blended formulation, and then it goes into the chamber of the e-cigarette or vaporizing device, and there's a coil in there that heats up to about 360 degrees. It vaporizes the oil, and you inhale that. You inhale it, but instead of blowing a cloud of smoke like you see on the street, you're going to hold on to that, and you're going to not release all of that vapor. So you're not blowing clouds of smoke, you're holding on to it and absorbing, hopefully, the maximum amount and delivering that to the brain and to the eye on an immediate basis.
So if we did have people who are interested in using your formula, we just connect them with you and you'll work it out.
Yeah, I mean, this is not a this is CBD, right? It's CBD
CBD
and
plus,
beta caryophyllene, so there's no THC involved. It should be
shippable.
Yes.
Cool.
Cool.
Great.
You can take it on an airplane too.
Great.
Great
'Cause
news.
I know one for sure who will do it. For sure.
Well, we might have to get over the because he was a smoker for many years and gave that up, so
Once again, you've got that stigma. I contacted a woman about that very specifically. You've got eye disease. You're very much afraid of eye disease. It's a terrible problem. I have a therapy, and you'll be vaping in order to reduce it. Oh, no, vaping is dangerous.
Right. Well, you do need, it's the same kind of thing. You don't want to buy your CBD from 7-Eleven. You don't want to be buying shoddy, batteries and, bad cartridges. You need to have quality, equipment.
That's right. So the problems that have come through with vaping have actually been because of adulteration,
right?
Where you got certain types of typically it's a THC product, but the product also has a vitamin E derivative in it, and that has led to these types of problems. Really, I've been using the vaporization and using this technique for 7 years, and I have not seen any significant problems with it.
Excellent.
Right.
That's great to hear.
Yep.
That's great to hear. So I know you took it upon yourself to study all this stuff, obviously after you were retired from the Army.
Yeah, I retired in 1997.
Yeah. So yes, after.
So this is my third career.
Yes, indeed. Are you still in touch with any of your friends from the Army? Do you talk to them about CBD and stuff?
Well, I'm collaborating with a colleague, not from my class and my year, but we're working together on a project. It's a Harvest 360 out of Missouri, and this particular program is trying to make inroads and provide different cannabinoid products to veterans across the country and even into the world. So we're particularly looking for traumatic brain injury and post-traumatic stress disorder as avenues for treatment for many people.
Oh, fantastic. Because the stigma, you still can't have CBD in the military. All the branches seem very adamant about warning their active duty that you can't even use CBD. So,
well, I don't know exactly of what you're speaking, but there's no reason for them to know if you had CBD unless it is full spectrum and they had THC, and you could test positive for THC. And so I don't recommend anybody whose livelihood or job or whether they might be involved in an accident to be using full spectrum cannabinoids because they'd be at risk for losing their livelihood. But it's unfortunate, and I think we have to change the threshold. The problem with those laws is that they're just looking for detection, and they're not determining intoxication, and that really requires a physical exam because no one drug level really designates as someone being impaired. So we've got these standards that are set legally, and that's interfering with making progress and self-treatment for many of the problems that we do encounter. In terms of self-treatment, Chelsea, you brought up earlier about how many people are using CBD. Well, there was a survey that was done for rheumatoid arthritis and the Arthritis Foundation, and they found that 80% of their members had actually used or were currently using CBD So it's out there if we're just hiding our heads in the sand, if we're not recognizing it's there. And that means that professionals need to know about the endocannabinoid system, how it works, and become familiar with the cannabinoid system and using phytocannabinoids and other substances in order to modulate human behavior and mental state. So I'm actually doing some lectures for medical professionals, albeit it's actually Australia, but it's producing a video platform so we can train medical professionals around the world and how to use these substances in an effective way.
Great.
Oh, well,
That's awesome.
that's the key. We're educating the physicians and medical professionals, working with them, and that's great.
Yeah.
Fantastic.
We have to educate the public, though,
Oh,
because
yeah. Oh, no, yeah. Oh, absolutely. Across
We
the
wrote
board.
a movie. We'll
Yeah,
see what
We
happens.
wrote a movie about it. Yeah.
So I know that you presented a lecture to the Washington Healthcare Association advocating for the use of cannabinoids for patients, clients, and staff. How was it received?
Well, it was cautious. Nobody had ever heard anything like this. The idea of using cannabinoids for their patients with dementia, I wanted to approach it from the standpoint of a cost basis. How can you control costs in this manner? And I think that the cost issue is more persuasive from business owners and hospitals than any other approach. And so if you've got agitated patients on the ward because of dementia, use a full spectrum type of cannabinoid in terms of reducing that degree of agitation. That's great. You're not going to get side effects or toxicities. We know that a lot of those psychotropic medications actually have long range and downstream adverse effects and inflammatory effects. Use cannabinoids in that particular process. You'll improve their mood and their function, and you may be able to actually reverse some of the dementia symptoms that they might be having. But I didn't want to emphasize reversal of the disease because that might be a stretch too far. Yeah. So I wanted to, so if you did that, if you reduced the anxiety and the sleeplessness and the agitation, then you wouldn't have to have as many staff on the team in order to take care of them. You wouldn't have to have the cleanup that would be involved with messes. You wouldn't be using any type of restraints in that particular process. You'd be able to be able to devote yourself better to the clients. So it's a different quality environment, and you wouldn't have patients yelling and screaming, waking up other patients. So you get an overall general situation that's going to be quite valuable for them. And then let's talk about the care providers, because they are at high risk for burnout and for stress and health issues. And the reason why is they're on shift duty and they're working in some very stressful environment, not to mention a COVID infection and that type of environment. So if you have staff members able to use cannabinoids, you may be able to reduce their stress, have them adapt to their different sleep times and their circadian rhythms, recover quickly and not create an inflammatory situation in their brain, and avoid post-traumatic stress disorder or a lot of the stresses that's related to it, improve their sleep quality as well, and treat their depression and anxiety. So there was a great study that was done in Brazil during COVID, and they had 21 health professionals that reported to a mental health clinic because of burnout and stress. They actually divided the two up. There were 21 who were controls and 21 who were not controls. They started treating them with CBD, and they were using about 300 milligrams. And in that particular process, they were able to, the workers all recovered. It treated their depression, anxiety. They continued working during that time frame. They had an uplifting of mood, and even when they stopped the CBD, they still had those benefits for the next month.
Wow.
Nice. In Brazil, because Brazil has some pretty strict laws.
Yeah,
and draconian leaders.
Yeah, well, yeah, it's definitely a mixed bag in Brazil.
Yeah.
Um,
Similar to Japan. I know that you presented a lecture on Alzheimer's in Japan in 2019. How was that received? What were the questions from them?
Well, there's a great deal of enthusiasm. You know that hemp goes back almost 12,000 years with Japan. It's part of their culture. They have a god that they respect and they revere related to hemp. And there's a period of their culture that is actually the Jamon period, which is actually designated by hemp rope that was on their ceramics. So they have this long, long tradition of using hemp, and particularly the native Japanese that are in the northern island of Hokkaido. So and yet during just post World War II, the U.S. kind of brought in that same the propaganda that said this was a dangerous substance and outlawed it.
Right.
Even though at every Buddhist temple and every Shinto temple, they have a stretch of hemp rope designated as part of that design and that culture. So in spite of it being part of their culture for millennia, they were still denied the growth of hemp in their country, as well as using cannabinoid products in any form. So I had the opportunity, I was trying to stimulate the industry to get a recovery of the industry and promote the positive aspects of how cannabinoids could have the biggest impact on the Japanese population. And with their orientation towards longevity and quality of life, I thought that Alzheimer's would be a particularly ideal target to discuss those particular benefits that they could see in their population and other nations of the world as well.
Wow, that's great.
Great.
And
Thank
just
you so much for doing that.
and yeah, this is the key to everything. And I'm just, it's amazing how destructive our prohibition throughout all the multiple levels of prohibition that have happened in this country with regards to hemp. Of course, I'm sure you're familiar with the emperor wears no clothes, but just all of the, we'd be in such a different world medically and environmentally
Nutritionally.
if this plant hadn't been destroyed, its access destroyed on so many levels. Now, your presentation on Alzheimer's a few years ago said the target dose was 25 milligrams a day of CBD. Is that correct? And I'm just blown away by those low doses. And cancer treatment, you were saying that 90 milligrams of CBD to treat cancer is very effective. Are these the dosages that you're finding, these low dosages in treatment?
Those are the dosages I find that have been effective. So in dementia, I told you earlier, an ideal dose is somewhere in the range of 10 milligrams twice a day, maybe 15 milligrams twice a day. You start with a low dose. Anybody who's over 70, they need half of a regular dose in order to get the same effects. Okay. And then I'm fairly assertive about getting people adjusted. So I'll have them actually double the dose and increment quickly in order to find an effective level. And you can see the changes in people right away when they are under the influence of cannabinoids, so the CBD in particular. So that can be very, very effective. Now, for other types of problems, it's variable. If somebody has pain, they may require as much as 200 milligrams of CBD, and you might be necessary to add in some THC in order to get that relief. My limitation as being an international consultant, I have to deal with all laws, and so if I stay with CBD, I don't have any problems. But if I can't send or recommend THC that somebody can get, so they have to procure it locally. I'll help them with it, but I just don't have a lot of experience, but I've not needed to in most cases to use that.
I would love to have care homes for people living with dementia that incorporate a healthy, veggie, heavy keto diet and cannabis medicine. I think that would be amazing.
And cost effective, right?
Well, exactly. And we would save the staff. They'd have less turnover. It'd be less expensive for them. You get better outcomes for the patients, and the family members would be elated at their interactions with their family members. It's not going to help everybody. Some people are not going to respond well. We have lots of different causes for dementia, and so people don't respond. And I've had my share of failures in that matter. But most of the time, you're going to get a particular benefit if it's a symptom or if it's being able to reverse some of the cognitive effects and the physical effects as well.
Sure. And sleep being just huge, for all of that, for everybody. You make yourself a better caregiver too. Eliminating all of that anxiety and getting better sleep. You're using CBD, right? Yeah. So
I don't think there's any reason why that our nursing home care, our residential facilities could not use cannabinoids and use it, incorporate it as part of their therapy. But they have to work with the regulations that are in their state, and they have to have funding. Now, I was working with a self-insured business from 2014 until 2020. And we were actually using CBD to substitute for some of the other medications. And because it was self-funded and this was not a prescription drug, then the company had to pay us directly for the materials that were being used. But they were able to save over $7 million in that process, because the drugs that were being used, like tumor necrosis factor injections, cost on the average of over $40,000 a year. And by substituting and using cannabinoids, then you're able to mitigate against psoriasis, rheumatoid arthritis, ankylosing spondylitis, and a wide range of other problems.
Oh my God, that's amazing.
So it can be incorporated, but you have to have some brave souls and entrepreneurs that are ready to get into some of the gray areas in order to deliver a better quality of care for their customers as well as their patients.
To break through the stigma, the regulation, the over-regulations.
Well, part of it is that you have to have orders for every single thing that anybody uses in a care home. So the doctors that they're working with have to provide orders and educate the staff. And
you're exactly right.
The families too will say, "Oh no, I don't want,"
Now, here's an interesting way that some of the families have been able to bypass that. Number one is that they come in with Mary's favorite cream, and we're just going to rub the cream and we're going to give her a massage. And so generally it doesn't fit exactly in the rules. And so they're able to give a CBD massage to the individual and have them wake up. And in another situation, they found that naturopaths were able to write orders for the patients that were in the facilities. And the naturopaths were well respected, and being able to write orders for plant substances, it was no difficulty for them. They would incorporate that as part of their therapy.
Oh, that's a great technique. Yeah, that's great.
Thank you so much, Dr. Blair.
Yeah,
we really, really appreciate having you.
We can stay in touch, and we'll get updates on your further developments on some of your work that you're doing with vaporized CBD and beta-caryophyllene. That's super exciting. And you're just on the leading edge of this. And thank you so much for being one of those doctors that are willing to get through this stigma and really educate people and show people the benefits of this. So thank you so much for all you do and for joining us on Cannabis Helps Dementia.
It's been a great opportunity to talk with you about. You've pulled out a lot of information here, and I'm glad to share that with you. And I feel greatly privileged that I have been given this particular information, or I had these experiences that I can share with others.
And how would they find you if they wanted to do a consultation or work with you?
Dr. Philip Blair, MD. Yeah, 1L, drphilipblair.com.
Dr. Blair encourages the use of cannabinoids and terpenes to improve patient care, reduce stress, improve behavior, and prevent staff burnout. He reminds us that CBD has great benefits for caregivers as well. We thank him for his time and continued work bringing plant medicine back for treating multiple conditions, including dementia. Find his products at blairmedicalgroup.com or follow our links in the description. Thanks for joining us for Cannabis Helps Dementia. Be sure to download, rate, and review us on your favorite podcasting network.
And please share this podcast with anyone you know in relationship with dementia.
Do you want to tell your story of how cannabis helps dementia? Drop us a note at coachchella.com or connect with us on the socials.
Check out the Society of Cannabis Clinicians website to find real medical professionals familiar with cannabis medicine in your area.
And don't forget, download, like, and share what you learned.
Cannabis helps dementia.
Why don't you get wise? Get up and get out. Get rid of that frown that's been dragging you down and get up in the air. Just pretend that you can fly. You'll never know if you can.